Welcome to the video for chapter 13.1. So in 13.1, we're going to talk about the concepts of sterilization and disinfection. So in fact, all of chapter 13 is all about the different ways we can control microbial growth. Okay, this can be through chemical ways, like by using chemicals, or by physical means, such as using something like this autoclave in this picture. So these are industrial autoclaves. They're a little bit bigger than the little guy we have in the back in the classroom. They work just the same way. You can just do more things at a time in this autoclave. Okay, so chapter 13, objectives. So chapter 13, as I said, is all about ways to control microbial growth. So we're going to talk about sterilization, disinfection, and antibiotic therapy. Okay, so some of the things that we need to pull out of chapter 13 is we need to be able to present the modes of action, the microbial spectrum, and clinical use of disinfectants and other antimicrobial agents used to treat infections. We'll be able to discuss how a given antibiotic is deemed clinically effective. Okay, we need to be able to describe the roles of empirical therapy, targeted drug therapy, and a concept called synergism in treating infections. We need to be able to explain how selective toxicity and the mechanisms of antibiotic resistance influence the development of new antibiotics. Okay, so let's start out chapter 13 with a case history. So we have Bill. Bill is a brand new, newly certified and graduated nurse practitioner. Okay, he's been assigned to a hospital team caring for a 9-year-old girl named Jill. Now, Jill is pretty sick. She has an infection caused by MRSA, so that methicillin-resistant Staphylococcus aureus. Okay, so as part of the medical team, somebody changes Jill's bandages every day. So on the particular day that this scenario happens, Bill is changing Jill's bandages when he suddenly remembers he needs to talk to Brenda, who's the nurse covering the desk on the floor. Now, we all do this, right? We're doing one task and then remember all the other things that we need to do. So his question had to do with when rounds started on this floor. Well, as soon as he got Jill's bandages changed, he's like, oh, I have time. Let's go ask Brenda now. Okay, so he ducks out of Jill's room and goes to the nurse's desk to ask his question. So as he's waiting for Brenda to look up the answer to his question, he's just kind of tapping his fingers on the desk. You know how people do? Well, unfortunately, Bill forgot to take off his gloves, so he's tapping his still gloved fingers on the desk. Okay, so Brenda finds the answer, tells him it, and then he thanks Brenda and returns to Jill's room to continue what he needs to do that day for her care. Okay, meanwhile, we have Anna. She's a physician's assistant at the hospital. She stops by the desk to read the chart of one of her patients, which is 15-year-old Penny, who just had her appendix taken out. Okay, so she just had an appendectomy. Well, Penny was doing well. Okay, but unfortunately, about a week later, Penny's dead. She died from MRSA infection. Now, you probably can see where this is going. There was some mistakes that happened in this scenario. Okay, so one of the things that we have to talk about MRSA is one of those really serious life-threatening escape pathogens that we've talked about. Okay, they're hospital-acquired pathogens, meaning that they're very easily transmitted, as we can see in this scenario, in the hospitals. Okay, unfortunately for when events like this happen, where Penny was doing really great and then all of a sudden she has MRSA, something went wrong there. So they start to run an investigation. So when they run this investigation, it's soon going to come out that Bill didn't follow protocol. He ignored the standard protocol that happens when you are going in and out of a room with a patient with something like MRSA. Okay, these protocols are put into place to stop the spread of this microbe from one patient to another. Okay, so this protocol is that anyone who enters a MRSA room must first wash their hands with antiseptic soap. Okay, they have to put on sterile gloves and don a paper gown to cover their clothes. This is all to stop the spread of this microbe. And the thing is once they've done that and they go to leave, they have to do the procedure in reverse. They have to take the paper gown off and put it in the biohazard bin. They need to take the gloves off, put those in the biohazard bin. Okay, and then they have to wash their hands with antiseptic soap again. And all these measures are designed to prevent the spread of these hospital-acquired infections. Now, if Bill had taken the not even 5 minutes, the 3 minutes needed to follow standard protocol, Penny would still be alive. Now, these are the type of things that get people in trouble at the hospital. Okay, this is most likely a lawsuit waiting to happen. Okay, so those of you who are going into the medical field, make sure you follow standard protocol all the time. That's important. Okay, so chapter 13.1, it's all about the concepts of sterilization and disinfection. We're going to learn a lot of vocabulary words. Okay, the section objectives are you're going to be able to distinguish between sterilization, disinfection, antisepsis, and sanitation. What do each of these terms mean in terms of microbiology? You will know the difference between bacteriostatic and bactericidal agents. Okay, and you'll be able to discuss the decimal reduction time and its use in sterilizing material. Okay, so let's talk about some vocabulary. Okay, so the first thing we need to talk about are the different levels of cleanliness that we can obtain and what the terms that we use to represent each of these levels of cleanliness. Okay, so we have sterilization, disinfection, antisepsis, and sanitation/decontamination. Okay, so when I use these terms, what am I referring to in the microbiology field? Okay, so in terms of cleanliness, sterilization is top tier. In fact, sterilization is the destruction of all living cells, whether they're pathogenic or non-pathogenic, whether they're endospores or not, okay, and viruses in a sample, okay? So we're going to kill everything. So sterile means there's nothing in it that can grow, okay? So sterilization can be achieved by chemical means, but most of the time sterilization is going to rely on something like an autoclave in order to kill the things with endospores on them. Okay, so sterilization is that top tier of cleanliness. Now, the next two terms that we're going to learn, this is the next level of cleanliness. Okay, so it doesn't destroy everything, but it gets close. Okay, so we have these two terms, disinfection and antisepsis. Both of them deal with the removal of disease-causing microbes. Okay, the thing is, disinfection is going to remove them from an inanimate surface. So this is going to be things like your desk, the doorknob to the classroom, or like a hospital bed in a patient's room. Whereas antisepsis, this is different because this is going to be the removal of pathogens from living tissues, such as the skin or mucous membranes. Okay, so one works for non-living things, while one works for living things. Now, with both disinfection and antisepsis, they may result in sterilization, but not always. Okay, it depends on what you're using to achieve disinfection and antisepsis. Okay, so the third level of cleanliness is sanitation or decontamination. Okay, where this is still clean, this doesn't get rid of all the microbes. Okay, in fact, sanitation is going to be where we reduce the microbe numbers to what we deem safe levels. Okay, you might be asking yourself, Miss Harker, what are safe levels? Okay, how do we define this? And the answer is difficult to say. Okay, because different microbes are going to have different numbers that equate to these safe levels. Okay, there's some things like pasteurization, which is a process of how we remove bacteria from milk. Okay, that has a different procedure to get to safe microbial levels compared to something else. Okay, it all depends on the microbe that you're trying to reduce the numbers of. Okay, sanitation and decontamination, this is kind of like a really clean house. We haven't gotten rid of everything, but it's clean. Like, we really want our dishes to be sanitized, right? We don't want any microbes that can cause disease to be on our plates and bowls, on our silverware. Okay, so just like disinfection and antisepsis, sanitation does not necessarily result in sterilization. Okay, so I would know these terms. You will be tested on these. Okay, so those are the different levels of cleanliness. Let's talk about the different terms we use to describe antimicrobial measures. So how do we take care of these microbial populations? How do we get rid of them? Okay, so we have two actions antimicrobials can use. We have what are called static agents and cidal agents. Now there is a difference between these two. Cidal agents are going to kill the microbes. Okay, they're lethal. Okay, we have different types of cytal agents. We have things like bactericides, we have fungicides, we have virucides, we have algicides. Okay, so bactericides are going to kill bacteria, fungicides are going to kill fungus, virucides are going to kill viruses, and algicides are going to kill algae. Okay, and we have a bunch of different cytal agents. Okay, so they're going to completely remove that microbe. Now, static agents, we can think about them as inhibitors. So what they're going to do is they are going to slow or stop the metabolism or reproduction of that microbe, but they're not necessarily going to kill it. Okay, so they're going to inhibit bacterial growth. They're going to suppress it. Okay, in fact, static agents work on the premise that a person is going to have a functioning immune system. And by suppressing that bacteria, if it's a bacteriostatic, okay, it's going to suppress it to levels that the immune system can step in and take care of the rest of that bacteria. Okay. Also, this is going to be different from different individuals. It all depends on how robust a person's immune system is. Okay, so just like cytal agents, we have different static agents that are going to affect different things. Bacteriostatics are going to inhibit bacterial growth. Fungistatics are going to inhibit fungi growth. Virostatics are going to inhibit viral growth. And algistatics are going to limit algae growth. Okay, so depending on the cytal agent or the static agent, they have different levels of effectiveness. Okay, so there's different factors that go into how this effectiveness between agents vary. Some of the ones that we're going to talk about are on this slide. I would know these. Okay, so some of the external factors that are going to influence how fast a cytal agent can cause lethal damage are things like the initial population size of the microbe you're trying to get rid of. The more cells you have in that population, the longer it's going to take for that cytal agent to take effect and to start to kill off that population. Another thing that we need to take into account is the types of cells in the population. If we have spore-forming bacteria, it's going to take a lot longer for that cytal agent to destroy the spores if they can at all, right? This is one of the reasons why we use autoclaves to sterilize things, because they'll take care of the endospores where not much else will. We do have some cytal agents that can, but there's not a lot of them. Okay, and in fact, a lot of agents can't get rid of spores, which is why you can think something is sterile and get growth in it. Okay, so another factor is the exposure time you have to a lethal agent or agent concentration. Okay, so different cytal agents have different concentrations. The stronger the concentration, the faster it's going to work. Okay, the longer the exposure to that, the better it's going to work. Okay, but the one that I want you to remember, and this is just as important as the type of cells and the population, is something that is called organic load. Okay, this is going to limit the effectiveness of cytal agents. Okay, so organic load is literally the presence of organic material that can inhibit these antimicrobials from working. Okay, so organic material are things like blood, feces, vomit. So in order for the antimicrobial agents to work, we have to remove that organic load. Okay, so we have to remove the blood or the feces or the vomit in order for the cytal agent to start working on the microbes. Now, we have ways to measure how effective a cytal agent is. Now, when it comes to sterilizing in cytal agents, we need to realize that they kill exponentially. So they're going to start off killing a little bit at a time, and then they're going to kill more and more faster, and our curve's going to shoot straight up. Okay, so this is what is called an exposure curve. So this is going to measure how effective a cytal agent is at getting rid of a certain microbe population. Okay, so exposure is in minutes. So this is how long that population has been exposed to the cytal agent. What we're looking at here is the D value. So the D values are a lot like half-lives in chemistry. Okay, so it is the time required to kill 90% of the cells in that population. Okay, so this is how we determine like new cytal agents. So we have new cleaning products that have been have come out in the last few years. So this D value is going to tell us how effective they really are. Do they really work? Okay, so one thing to be aware of, I did say cycle agents kill exponentially. Now, if you're looking at this graph, you're probably thinking like, Miss Harker, that's a linear graph. We're decreasing linearly. Well, this is a logarithmic graph, okay? The y-axis is a logarithmic scale, which means that each of these numbers on the scale are 10 raised to this number. So 10 to the 0 is 1, 10 to the 1 is 10, 10 to the second is 100, 10 to the third is 1,000, 10 to the fourth is 10,000, 10 to the fifth is 100,000, and so forth and so forth and so forth. Okay, so with the D value, our goal is to reduce the number of organisms to 10% of the original value, aka kill 90% of them. Okay, so if we look here on this graph, this is our level at 100%. So we can see here that this is what our level is when we've killed 90% of the population. Okay, we can see these different exposure times. Okay, so the faster that it can kill 90%, the better the cytal agent is. That is chapter 13.1. So we've talked about sterilization, disinfection, antisepsis, and sanitation / decontamination. You need to know these terms. These will show up on the next exam. You need to know the difference between static and cytal agents. Okay, you need to know what organic load is and how that hinders antimicrobial compounds. And then you just need to be able to tell me what the D value does. So how do we measure the effectiveness of these cytal agents? Okay, so that is 13.1. We will see you in the video for 13.2.